my name is Hope Gailey. I'm glad you're here. Welcome. I'm a second-year medical student at UNC School of Medicine and a leader in the Triangle Christian Medical and Dental Association. I expect to graduate from UNC School of Medicine in about 2024, but that's pending a degree or certificate at Duke Divinity's TMC initiative. I plan to pursue a career in pediatrics, hematology, oncology, and/or palliative care, and I want to now introduce our panelists. So first, our first panelist is Dr. Farr Curlin, who is a Josiah C. Trent Professor of Medical Humanities. He's a practicing palliative care physician and works in both the School of Medicine's Trent Center for Bioethics, Humanities, and History of Medicine, and the Divinity School's Initiative on Theology, Medicine, and Culture. He works with Duke colleagues to foster scholarship, study, and training regarding the intersections of medicine, ethics, and religion. He completed internal medicine residency training and fellowships both in health services research and clinical ethics at the University of Chicago before joining its faculty in 2003. Dr. Kirlin's empirical research charts the influence of physicians' moral traditions and commitments, both religious and secular, on physicians' clinical practices. And our second panelist is Dr. Ross Wagner. He is an associate professor in the Divinity School and taught biblical studies for 15 years at Princeton Theological Seminary before coming to Duke in 2013, focusing on the ways of scriptural interpretation shaped by early Jewish and Christian communities. He's written books on Paul's letter to the Romans and on ancient Greek translation of the book of Isaiah. He's currently working on a book that explores the ways Isaiah's oracles influenced early Christian beliefs about God, Christ, and about the people of Israel. An Anglican priest, Wagner is actively engaged in ministry through his local church, and he just received ordination. So congratulations. So thank you, panelists, for joining us today. I want to give an introduction into the motivation of this seminar. So in my first year of medical school, we started anatomy lab, and this was with 30-minute introduction to the well-ventilated room and the bodies we would be dissecting. The instructor wanted to give a space for the hesitant students like myself and to encourage the gratitude for the students who were eager to put their hands and brains to work. We spent time thinking, nervously unzipped the plastic, and became oriented with the body before us. The next time I returned to the anatomy lab, the anterior thoracic wall, or rib cage, was separated from the rest of the body. I reminded myself that I was thankful to simply be observing that day rather than the one with the tools. A few days later, my lab mates were more cautious than myself, and knowing we had to get to work, I was the one that took a look at the heart and volunteered to start. The stress of medical school led me to maximize our time in this class, but a big part of me was asking questions that were difficult to push aside. Throughout my first year, I became more comfortable and confident in the lab, taking the lead on occasion. But every session, something would spark a pause, and I'd look at the forearm muscles and incidentally hold this body's hand. I'd observe ligaments in the fingers and notice that there was nail polish. How was it that the body was an example of human anatomy, but lacked the very essence of what it meant to be human, or what I thought it meant to be human? I was wondering, was the breath of God there? So these moments, together with reflections on my own illnesses and what it means to be a co-heir with Christ, have led me to this seminar and meeting with Dr. Wagner and Dr. Kirlin. So I'd like to ask the first question. And this is the first few questions will go to Farr. So where did you first encounter a dead body in medical training? What were some of the assumptions around death and dead bodies at the time? And what were those experiences like for you?
Hope, like you, I first encountered the dead body in the cadaver lab, and I remember it well. It might still be in the same place, and that building starts with a B. It's real tall, and anyway, it was up in the top floor at the University of North Carolina School of Medicine. And I resonate with that kind of sense of being awkward and careful and sense that something serious was going on. In fact, if there were two things that I recall characterizing that experience for me. It was one, seriousness, and that had a few components. I remember that we were brought to the experience as if we were doing something where following the norms we were about to be taught was really important. This was not a fooling around time. It was not something to be joking about. And later at the University of Chicago, when I taught students who were doing anatomy, I remember the director, a guy named Ross, telling students every year that here's the norms of how we're going to do this. For example, you're not going to take any piece of a body out of this lab. And I remember looking at them and saying, if you do, you will not become a doctor. And there was that kind of heightened seriousness, greater than anything we'd encountered to that point. There's also this recognition that we're crossing a boundary here, that we were doing something kind of transgressive, something that violated normal social boundaries. And so there was a palpable sense that this is a space where you're going to get to do something you otherwise should not do, for good reason, but it's because it's that kind of an activity, there's particular care to be taken. As you experienced, as every medical student experiences who does gross anatomy, we do things, we basically mutilate the body. I mean, you could see it that way. We take it apart piece by piece. We leave it in a pile of pieces in the end. And so how do we make sense of that? How do we do that in a way that shows proper respect or reverence or seriousness about what we're up to? And, I, like most people, had not really been around dead bodies at all. It wasn't just that I hadn't cut one, but I had not really touched one. I'd seen a couple, looking over into coffins during funeral services, but the people who I loved who had died had not died in my presence. Had not died in my home. And so, like, as we know now from research, like almost all young people today who come to this experience, I'd had no experience with being around corpses, or people who were about to die. So that was a part of the seriousness. And just a third part of the seriousness was this sense of reverence, which I even then found interesting and have come to reflect on and find particularly interesting in the years since. I would describe it as we got the message in so many ways that a lot of work had been done and a lot of history went behind, and a lot of people efforts were focused to make this thing possible we were about to do. And particularly, people had offered up their bodies to be dissected, and that was a serious thing. I think we all sensed that was a pretty big deal. People had said, these students who I have never met can cut up my body after I die. And the way that cashed out for us was a sense that the way you show a proper response to that seriousness is to be serious about learning, like do the work, be painstaking in your and careful in your dissection. Learn all that you can learn so that this sacrifice that's been made, or this gift that's been given by those who allow their remains to be dissected after they die, is not lost. It's not treated as if it's cheap. And so that's the first thing, is this kind of seriousness in those dimensions. The second thing I remember is that the sense that this was a part of our training, that not just our training to know human anatomy, but our formation of habits to be clinicians. Fred Hafferty, a famous medical sociologist, has talked about how the cadaver is the first patient. That in our training, this is the first human. It's actually not a human being, but it's the remains of a human being that we encounter. And so, I remember even then thinking, and I've come to reflect on this more, that like the way we transgress social boundaries within the space of the gross anatomy lab, We do things we would not be allowed to do anywhere else. And if anybody else was caught doing what you did up in that 6th floor of Berry Hill, you might go to jail, or at least be blocked from ever doing any reputable position again. But like that, doctors in their practice of caring for those who are sick and attending to those who have health concerns, we likewise have to do things that otherwise no one should do. Ask people to take their clothes off, put our fingers in their orifices, ask incredibly intrusive questions that are really inappropriate, but for the kind of work that we're committed to, if we're committed rightly to it. And then another piece about this, it was our first patient. It was an introduction to the way we're going to have special privileges that require special trustworthiness. And then I think another fascinating thing was the way that in this experience, we got in touch with a tension that runs all through medicine, and that is between the particular and the universal. Maybe it was that the cadaver we were dissecting had brightly colored nails, painted nails, or the cadaver we were dissecting was morbidly obese, or was incredibly emaciated, or had an amputation, or had an artificial hip. I mean, what you saw was every one of these cadavers was different. And yet what we were learning there was or ostensibly learning there was human anatomy. So I think the way that we almost had to go around the room to learn all these particulars in order to get knowledge of the universal abstraction, human anatomy, was a kind of reminder that we only encounter individuals, and this abstraction of medical science or medical knowledge, we always have to remember that any individual is not going to correlate with that abstraction entirely, certainly not going to be contained by that abstraction. So those are some initial thoughts on my experience.
Yes, thank you. I think that's a really good point. We only encounter individuals. Can you briefly comment on how you've approached dissection of dead bodies for medical training in light of the Christian affirmation of the resurrection? What are your thoughts on that briefly?
Yeah, well, I mean, the other thing that happens in cadaver dissection experience is that we're confronted, if we have eyes to see, we're confronted with the limits of medicine and with human mortality. I mean, so we're faced right there with our future staring back at us, so to speak. We are all going to end up as dead as these cadavers are dead. And so I think that's a reminder for those who have eyes to see as well, that Christian hope is not in not dying. Our hope is in the resurrection. And that's important because that plays out in medicine. Much of what patients are struggling with is a hope that they will not die. And medicine is doing its damnedest to keep them from dying. But as you see, when you're dissecting the bodies and you find the person with an artificial, like a graft of their aorta or a valve in their heart that was put in medically, you see that medicine has tried, to keep this thing going. And yet in the end, everybody dies. And I think the other thing that as Christians, it's important for us to witness is that the resurrection is the resurrection of the body. That's a part of the Christian story. We're not resurrected to a universality of form where everybody's like going to become the ideal human, which is an abstraction, but we are going to be resurrected as the distinctive embodied beings we are. Obviously in a new way and in a mysterious way, our resurrected bodies are not exactly like our current bodies, but they are a resurrection of bodies. And I think that truth can foster in Christians a fitting kind of reverence for the particular person who's in front of them.
Thank you. And Ross, I'm now asking you to speak a little bit to those points. So if you could spend a few minutes talking about dead bodies and the reality of death in the New Testament, particularly in light of the Christian affirmation of the resurrection.
Yeah,
And the
thank
second
you.
part of that is, how does scripture guide us to think about the relationship between the body and we hear the soul and the mind as markers of identity?
Yeah, good. Well, let me start that. I'm going to share my screen real quick here. Just, there we go. All Christian thinking begins with Jesus crucified and risen from the dead. And so a Christian account of what it is to be human has to begin with Jesus. Christians believe that Jesus reveals to us what it is to be God, and at the same time revealing to us what it is to be human. So just a couple texts from Paul's letter to the Colossians, that Jesus is the image of the invisible God, the one who shows us what God is like. There's an echo here as well, though, of Genesis 1, God creating humankind in his image, so that Jesus images to us not only God, but humanity. And Jesus' incarnation shows us that embodiment is integral to what it is to be human. It's in coming to take on our flesh and blood that Jesus shares our humanity. So the letter to the Hebrews, because God's children, you and I, share flesh and blood, Jesus likewise came to share the very same things, becoming like us in every respect, and so not being ashamed to call us brothers and sisters. That Jesus' embodiment is a window then into what it is for our humanity, what it is now and what it is to be, is a theme that runs throughout the New Testament. Paul's letter to the Romans speaks about baptism being joined to the life of Christ as involving a person's sharing in Christ's own death and burial, sharing in that death so that the newness of Christ's resurrection life might also be manifest in our bodies. And there's an already not yet to that. That is, those who are made one with Christ through the Holy Spirit both already share in these dying bodies a newness of life, but look forward to something not yet manifest, which is sharing in the resurrection life of Christ. And the connection between the already and the not yet for the New Testament writers, again here from Paul's letter to the Romans, is the Spirit of God that by faith comes to dwell in us, so that Christ lives in our mortal bodies, giving life to those mortal bodies through the Spirit. This means that on the one hand, there is a taste of the life to come. The Spirit is described as first fruits or down payment or guarantee of that life. But there's also a deep longing, as Paul puts it, we groan inwardly, waiting for the redemption of our bodies. So Christians live both in the hope of resurrection, but with a clear-eyed sense that the bodies that we now inhabit are dying, and that what we really hope for is yet future. There's a significant sense in which, as I've said, Jesus' incarnation, Jesus' resurrection are the shape of the hope that Christians have, and the way that we live now in the body is shaped by that hope. There's one further notion that Jesus' resurrected body has now come into the very presence of God. And so through Jesus' ascension, because we're one with Jesus, there's a sense in which our future life, our future embodied life, is already there with Jesus in the presence of God. So again, to Colossians, Paul says, you've died and your life is now hidden with Christ in God. And when Christ, who is your life, appears, then you also will appear with him in glory. It suggests that whatever our resurrected bodies are going to look like, the archetype for that resurrection life is the resurrected body of Jesus. So in a letter to the Philippians, Paul speaks about the Savior who will come to transform our humble bodies so that they'll be like his glorious body. If the connection between our present body and our future body is Jesus, crucified, resurrected, ascended to God, then how do we think about the connection between these dying bodies we now inhabit and the bodies to come. And there are two places in Paul's letters that give us some metaphors to think with. And I think this is the best the New Testament has to offer us, are images. So the first set of images comes in 1 Corinthians. Paul is speaking to his brothers and sisters in Corinth, some of whom have a hard time believing that the idea of a resurrected body is any kind of good news at all, that it's even possible. And so he asks here, if you're troubled by the question, how are the dead raised? Think about planting. What you sow doesn't come to life unless it dies. And when you sow, you don't plant the body that will be, but a seed. God gives it then a body as he's determined. And there's a lot we could come back to here if it were necessary. But Paul is basically saying that embodiment takes lots of different forms. And with human beings, the resurrection of the dead is not so much a putting off of one body as a putting on top of it another kind of body. So the body that is sown in the ground is perishable, it's raised imperishable. It's sown in dishonor, it's raised in glory. It's sown in weakness, it's raised in power. It's sown a natural body, it's raised a spiritual body. Scholars debate what exactly Paul means by natural and spiritual. Even translating the word is a little odd because the natural body has to do with the psyche, the inbreathed life. The spiritual body is a body that's under the control of God's Spirit. But they're both bodies. There's not a kind of contrast between disembodiment and embodiment. Again, for Paul, the key is that we'll be like Jesus. So just as the first human was a living being and the last human a life-giving spirit, so Paul says here at the end of the passage on the screen, just as we've borne the image of the earthly man, so we'll bear the image of the heavenly man. The body that we inhabit now, Paul says, will be raised imperishable. There will be continuity, but also transformation. And he uses here in 1 Corinthians 15:54 the imagery of putting on clothing, the perishable that's clothed with imperishability. Or another metaphor, death swallowed up in victory, the mortal swallowed up by immortality. In 2 Corinthians 4 and 5, Paul switches the images a little bit. He speaks about a human being as having a kind of outer self and an inner self. And I think it's important to note that although the New Testament writers, including Paul, can distinguish between body and soul and spirit, they tend to speak about human life as a whole. And so this outer human, this outer anthropos, which is wasting away, exists at the same time as an inner human, an inner anthropos that's being renewed day by day. And it's this being that is being renewed that will one day be clothed in a resurrection body. So here another set of images. An earthly tent that we now live in that will be destroyed, but a building that we have from God, a house not made with hands that already exists for us with God in the heavens. And Paul says what we're longing for is not to be disembodied, not to slough off this body, but rather to be clothed with the immortal body so that our mortality can be swallowed up in life. And once again, it's the Spirit of God dwelling in our mortal flesh now that is the guarantee of sharing that life to come. Thinking about the connection between the body that we leave behind and the body that we will inherit, Paul can imagine a kind of in-between state in which not yet in our resurrection bodies, we're yet at the same time with the Lord. And the way Paul puts it here is as long as we're at home in this body, we're away from the Lord because we here walk by faith and not by sight. What we prefer would even be to be away from this body so that we could be at home with the Lord. Whatever it is, life or death, the meaning of being human is for Paul being in relationship with Jesus, the one who gives us life. So these are some of the ways at least the New Testament gives us of thinking about the connection between the bodies that we inhabit, the bodies that are promised to us. The I that exists is an I that exists in relationship with Christ, and that's true of the now and of the body to come.
Thank you. I think I speak for many people when I read the letters to the Corinthians with a new perspective just now. So thank you. Now I want to ask about one question for each of you before we transition into like a broader Q&A starting around 110. So first for Farr, this is going to be more specific and have more practical questions to clinical and pastoral encounters. So how do we regard the person whose body is still functioning but is legally brain dead? Is this a living body or a dead body? And is life and death a continuum or a dichotomy?
Good question. This highlights a really important contrast that we confront when we encounter someone with a significant brain injury, and particularly with the question about whether they are brain dead and what brain dead implies. The contrast is that while it is straightforward that we all will die, and in most cases, it is straightforward that someone has died, yet, so that's straightforward, and that's dichotomous, living versus dead. The concept is dichotomous. Yet it is often not possible to say when precisely someone has died. Now, through all of history and still in almost all contexts around the world, if we have any ambiguity about whether someone is dead, we humans would just wait a little longer. Has she died? I think so. Well, is there a little color left? Or I think I may have seen her chest rise. Well, let's see. You'd wait a while, and then you'd get clarity that they have in fact died. There's nothing really to do but wait and observe. But now we're in a moment where the one who is dying and potentially has organs that can be harvested to sustain the life of someone else. And that puts pressure on us to figure out some non-arbitrary criteria for concluding and just practically treating a body, concluding that a body is dead, treating that body as if it's dead. I think we have a good reason to do that, and we can talk about that more if folks want to, but good reason as Christians to accept the non-arbitrary criteria that have been put forward, specifically the criteria of brain death. And I'll just say very briefly that criterion is built on the philosophical presumption that to be living is to have an organizing principle, or you might say a soul. And here by soul, we don't mean like that the angel that is put into the otherwise living creature could be taken out and the creature still living. We just mean that form of the body, as the ancients called it, that the thing that makes us more than just a pile of parts, but actually a living being. And that if the brain is completely injured, then no longer do you have an operating principle, something that keeps it more than just parts. But I think we have reason to accept that. But we at the same time should not fool ourselves that we have complete certainty in such cases that for sure and for certain this person has died. It's just that because there's such ambiguity, and it seems we need to come up with some criteria that for treating them as if they've died.
Thank you. And for Ross, in your encounters with parishioners, how do you navigate the apparent finality of death and dead bodies while trusting in the resurrected Jesus? You may have already covered this, but if you'd be willing to expand on that.
Well, I'll maybe pick up a little bit on what Farr's just been talking about. I had an experience quite a few years ago sitting with a family in our church in Duke Hospital whose 16-year-old daughter had been hit by a car backing out of the driveway, and within 12 hours, brain activity was no longer really evident. And we sat together with some really thoughtful people from the hospital system as they encouraged the parents to donate organs. And it was clear that what was motivating, or the kinds of things that were motivating the parents, who were both really mature, lovely Christian people, was a sense of how to honor both the person of their daughter, who was still breathing and still warm, and whom they still were embracing, as well as to acknowledge that there was not a road back to health, to life. And I think one of the notions that they had imbibed deep down was actually Jesus telling his disciples on the eve of his own death, there's no greater love that a person has than this, that they would give their lives for their friends. And I think they were able to see that this would be a way that their daughter would be giving her life for others. At the same time, I just remember mom saying, there's a dress that we want to have at the funeral, and it don't cut above this, don't cut below, above this line, because we don't want the incision to be visible. It wasn't as if they were treating the daughter's body as no longer their daughter, but they could see that her life was also not located exclusively here. I was with them as well in the funeral as they celebrated both their daughter's life now in the presence of God, but also really grieved that absence. So I think a Christian hope in the resurrection can lead to actions like donating the organs of a loved one. At the same time, they shape grief, but this belief in the resurrection certainly doesn't take away grief. If anything, it reshapes it as not the end of a loved one, but the absence for the foreseeable future of a loved one. And that kind of absence, this is a person still alive with God, but not present with us, that both guides the way a family will care for a body, but also that leaves a real hole that is resolved only in the future, only in resurrection. And so leaves a lot of room for grief, not for a kind of trite, it'll all be okay there, but a real weeping and mourning, and yet not without hope.
Yeah, thank you. That's a powerful reflection, and something that I've thought about too, of how organ donation is almost a giving of oneself and sacrificing of oneself for another. We actually have a few more minutes before I open it up to Q&A. So I wanted to go ahead and ask a question that was paraphrased from a first-year medical student at UNC. So many first-year medical students have recently discussed death and dying and cultural beliefs in their social and health science course. And so this is more for Farr, but Ross, you're welcome to pitch in as well. From the beginning, we're trained to desensitize ourselves from the emotional aspect of caring for patients and their families. We talked briefly about how anatomy lab is desensitizing, or how we're encouraged to in some regard. How do you remain grounded or remember hope during the times of caring for very ill or dying patients as a palliative care physician?
Yeah, in the cadaver lab, you confront in a very striking way a tension, though, that runs all throughout medicine. And throughout its history, people who observe medicine and medical training have noted this tension. And this is a problem clinicians have to learn to deal with well if they're going to avoid the kinds of corruptions and perversions to which they're prone. And the tension is that between medicine as this scientific, technical, objective practice in which we treat the patient like a specimen, in which we apply universal knowledge, namely scientific knowledge, to manipulate things in the patient. And, this is seen probably most strikingly and appropriately when you're under anesthesia in the operating room. The surgeon there is acting toward the body like it's kind of a specimen that they can understand scientifically and manipulate, hopefully for a good end. But that's in tension with the way that medicine is a moral, spiritual, inevitably subjective in certain respects, vocational practice, calling, in which you walk alongside and care for fellow human beings who are neighbors and citizens and even friends. So how do we deal with that tension? The late famous medical medical sociologist Renee Fox used a concept of detached concern. She said that's the ideal that medical training is aiming for, is detached concern, a kind of care and seriousness, but not too much. The famous, most famous physician in the United States, William Osler, used the term equanimitas or equanimity, which was an ideal that conveys a kind of balance between like detached concern of seriousness and focus and care and concern, but not being drawn in the way, say, a parent would with a sick child, where you're overwrought and you can't act with dispassion and with clarity. I think personally, going through the training myself and watching many others, being involved in teaching, that it really is not necessary to encourage students to not get detached morally. I mean, not get too detached emotionally. That instead of, and this kind of draws on Aristotle's idea about aiming at the mean relative to us. So he had this idea that between virtues and vices, you have kind of a spectrum, you have a spectrum of, and virtues are kind of aiming at the mean between, let's say, being too angry and excitable versus being too passive. And the virtuous person is in the mean. But he said we have to aim at the mean relative to us, which means that we have to be aware to which extreme, to which way of going wrong are we prone? Do we have a tendency? Because if we have a tendency all in one direction, there's no point in aiming at the middle. We have to aim at the other end in hopes of getting to the middle. Does that make sense? Mm-hmm. I think that's the case with this. Between detachment and concern, all the tendency, all the structures, all the habits, all of our human frailty pushes in the direction of detachment. We all learn detachment incredibly well. Everybody learns to dissect a cadaver. People who say, I don't think I could ever do this might be overwhelming, may have tears for a day or two. 2 or 3 weeks in, everybody's doing it, and not many are losing sleep at night. Same thing with treating patients. It's too easy to become detached. So it seems to me in terms of just good moral formation, is we would reasonably encourage everybody to be concerned, to always nurture concern, to consider it an achievement if one feels emotional after caring for a patient, rather than a problem. And I'll say one more thing briefly about this. We have to recognize the problem that the cadaver lab can kind of sow in us, and that the rest of our training can amplify. And that's the problem of seeing living bodies as animated corpses. Jeffrey Bishop, a colleague of ours, has written a book. It's a difficult book. It's a worthwhile book, I think, for people to struggle through, called The Anticipatory Corpse. But a piece of his argument is that we tend in modern life to think of living beings in terms of the matter that makes them up and the efficient causes that move that matter around. We don't think of them in terms of what the ancients called final causes, meaning what's their purpose? What are they becoming? What does it mean to be fully human? And medicine has been made effective by treating patients as matter and figuring out how to manipulate the matter to kill the cancer, to get the diseased organ out, et cetera. It's been marvelously successful in many respects. And yet ultimately, we as physicians encounter human beings with stories. They belong to particular people. They have vocations. They are created by God. They are going toward God. And to think of them in terms of just matter and motion is ultimately not to do them justice. And many, many patients in the past, in the present, and unfortunately, I'm sure it'll be into the future, will experience their encounters with medical professionals as if they were treated like an object. And so to resist that, we have to aim for concern. That's my experience. I do hospice and palliative medicine. I've seen hundreds of people die. And I'll just tell you, it doesn't affect me a lot emotionally because it's just really easy to get used to that. So what I have to do is sustain through habits, through prayers, through particular ways of entering a room, through stopping and paying attention to what's going on in myself, noting this is a living being created by God who's made for eternity. This is what someone who, like C.S. Lewis said, is if I could see them if I could see the spiritual realities, I'd either be horrified by them or want to fall down and worship them. That's the seriousness of what's going on here. That has to be nurtured for me to have even a semblance of the kind of concern that's fitting in caring for the people that God has created.
Thank you. Yes, I think I see those patterns too in the School of Medicine of even just seeing a flyer at class this morning of how to nurture compassion, join this 3-credit-hour course for the spring. So that's a real experience and something I long to nurture throughout the rest of my medical training is to remain compassionate, continue in those practices of prayer and meditation of what's going on in the rooms of patients. So now I want to open the floor to questions. So first, if you could raise your hand and I will choose a name and you can unmute yourself and please turn on your video and that way we may hear your question. If you have a specific question for either Ross or Farr, please share that. If not, you can ask both of them to answer. So first I'm going to choose, I saw a name come up first. Got to figure out who it came from.
Yair Koenig, it looks like.
Yes. Well, they unmute themselves and ask their question.
Hi. So I can't turn my video on. I think that's blocked on your end, but as long as you can hear me, I can still ask my question.
We can hear you.
So I recognize that my question probably deserves a lot more reverence than I'm going to give it, but in respect to time, I'm just going to kind of get right into the nitty-gritty. Both Doctors Curlin and Wagner have talked about this idea of through different terminologies. You've used words like sacrifice, anthropos, the separation of spiritual and natural bodies. There is kind of like this division that keeps coming up that doesn't appear to exist after death, at least in the physical body. From the religious end of it, I don't think that there's ever a point where we ever talk about a dead subject being sacrificed. I think that that's kind of like almost against the rules, that for something to be sacrificed, there had to be alive in order for it to be accepted. So in light of this conversation where we're talking about the body being essentially a vessel, and for this item in the conversation, we're talking about the body being an empty vessel, why are we essentially giving so much respect to the empty vessel? Am I coming across clear at all in terms of, I'm not trying to oversimplify it, but it's a cadaver, and I recognize that it does need respect, but I'm trying to dig into a little bit of why.
I think Ross could probably give a more theologically grounded response, but I'm just mentioning a couple of practical things. So it seems to me, if you look at the Geneva Conventions, the International Red Cross has a compendium of international health law. It's striking that in all cultures, including nations that are quite secular, including nations that are majority Muslim, including Israel, including obviously a lot of nations that are majority Christian. There is a respect, part of respect for the living, the basic respect we owe the living is respect for their remains. So that just seems to be all kind of central to human experience, that throughout the centuries, that if you want to show respect for the living, you show respect for their remains. And in fact, if you want to show disregard, you desecrate their remains. And a second, that's one practical thing. And the second one is that specifically with respect to cadavers and handling the body, I think there's just been this observation over, again, centuries, but it's certainly including in the modern period, that if you treat cadavers with what would otherwise be considered disrespect, it tends to be a harbinger of similar kinds of treatment of living people. So I'm sure, Ross, you could take it from there.
Yeah, I agreeing with all that you've just said. I think again, just to speak from within a Christian frame of reference, but people are not ghosts in a machine. I mean, the body is not a vessel for something that's human. The human is an embodied being, and so it's actually it's difficult to talk about what it looks like to have a stage where one isn't embodied. There's a human body that belongs to this creation. There's a resurrection body, but the human embodiment is also an embodiment in relationship with God, in relationship with other humans, with the creation, so that again, Paul can talk about an existence, an I who continues to exist even when this body is just remains, and the resurrection body isn't yet a reality, because one lives in relationship to God. And I actually think that there's a lot of, John Swinton, among others, has really explored the importance of thinking about relational identity for asking questions about dementia and how a human person can continue to be remembered by a community, by God, even if they can't remember themselves. And so I think by extension, those human remains are still in relationship. If the I is not inhabiting, is not completely identifiable with those remains, they're also not just meat. I mean, they're what was a human being. And they're also, that cadaver represents what I'm going to be someday, what the physician is going to be someday. That's a future self. And so I think treating the dead with respect is deeply connected to how we treat those who seem to live a less than fully engaged human life, those who live our lives but look so different from us. We've talked a little bit, I think, Farr, you mentioned Fred Hafferty earlier, but this book that I got on your recommendation and read, Into the Valley, about first-year medical students in the anatomy lab. I mean, he drew a pretty stark contrast between those whose attitude toward the cadaver in the anatomy lab led them to just continue to even increase the way in which they thought of themselves as other than their patients. Those able to manipulate a patient in ways that the physician would never submit to him or herself, versus an attitude that saw the humanity in the cadaver and was led to think about medical practice as sometimes needing to detach in order to do something that ultimately led to the flourishing of fellow human beings. So I think respect for the dead is deeply ingrained in human culture, because there is a real sense in which those remains are human remains. They are not suddenly pulled out of a whole web of relationships such that we could treat them like so much leftover corn husks.
Thank you, Yair and Ross and Farr, for those reflections. I have a question that was messaged to me by Tamara Fitzgerald. So Tamara, would you be able to unmute and perhaps turn on your video to ask your question? If not, I
Go
may
ahead,
go
Tamara.
ahead.
We can hear you now.
Sorry, it won't
Okay.
let me start my video. But thank you very much for this conference. I just wanted to bring up a question, which is kind of about grief and about grieving well. Because as clinicians, I think we do experience a lot of loss by being connected to a lot of traumatic things that happen to other people. And, you know, as Farah was saying, not all of those things we become emotionally invested in, but we all have experiences where those things have really affected us. And if we minimize that and we don't grieve well, I think this can lead to our own spiritual non-health. So I guess my question is, if you have any comments about what the Bible or the life of Jesus has to say about grieving well and how that contributes to our healing.
Ross.
Not thinking so much of a specific text, although actually now I do think of one, which is Jesus at the tomb of Lazarus. The shortest verse in the Bible as it's been divided up into bits. Jesus wept. And this is a Jesus who in the Gospel of John goes in saying, you know what, the sickness is going to show the glory of God. He tells his disciples, Lazarus is asleep. He's going to come back to life. And yet there's something about encountering the devastation of the image of God by death, the grief of Lazarus's family and friends that Jesus doesn't minimize but joins in. So that's a text I think we can think with it that would just suggest that there's a real place for tears and for grief, and that grief, the grief of losing a dear friend, is something that God knows as a human being, which is, it's not a foreign experience to the one that we look to assuage our grief.
I just, as Ross was speaking, I mean, I think about something Ross referred to earlier, which is Paul saying, we grieve, but not as the world grieves. We grieve not without hope. And I think there's something about, I've watched a lot of people grieve, obviously, taking care of a lot of people who have died. I love this, what I understand to be this dimension of Christian moral theology or Christian ethics, this kind of Christian instruction about how to live. And that is, there's a huge range of freedom here, that we can grieve in a way that includes sobbing, includes shouting, includes anger, includes quiet, includes thanksgiving, includes telling stories about how the fact that the person's in a better place, which is just kind of a lay person's way of talking about the hope of resurrection, can include all kinds of things. But it's not going to include is either a suggestion that nothing has been lost and that, it's no big deal because death is natural and, let's just move on. And it's not going to include a hopelessness and despair. But between that, there's it seems like there's a lot of different ways that Christians grieve in a way that shows their love for the one who's lost, their sadness, and also their gratitude and their hope.
Thank you for that question. I now want to call on Skylar Bain to ask his question.
Hey, thank you all for your time. Hope you can hear me well.
Yes.
Great. So I'm one of Hope's classmates as a second-year medical student, and when I was in the anatomy lab last year in particular, I felt the kind of Platonic, dualistic Western conceptions of body versus soul become particularly apparent in that space. And I'm just thinking if we can push our definition of what it is that we encounter before us in this cadaver a little bit further. I heard you both mention the cadaver as human remains and mentioning that it may still have a relational component. I'm wondering if we can, if I could hear you push that definition even further in contrast perhaps to Platonic dualism.
So I'm just speaking as one who's not been in the anatomy lab and not faced what you all have faced. I've been thinking over the last couple weeks about some stories in Scripture where people would rather submit to torture and death than give up their hope in God, and it suggests to me that human remains are the kinds of things that someone may choose to lay down in the hope of something better. And I don't know if this will be helpful or not. It's very non-Platonic, though. The book of Second Maccabees, which is a text written maybe 100 years or so before Jesus. It's in the Apocrypha in Protestant Bibles, or it's part of the deuterocanonical literature. It tells a fairly gruesome story of 7 brothers who were tortured to death, one after another, by this Greek king Antiochus, and then their mother, who's had to watch all of this. But there's a sense in the defiance as they're being tortured because they won't give up their ancestral traditions of worship toward God. The one brother threatened with having his hands cut off, his tongue cut out of his mouth, says, you go ahead and take these because God is going to give them back to me in the resurrection. The mother says to another of the sons, endure this. I don't know how God formed you in my womb, but I'm confident that God will give you a resurrected body. And there's a New Testament echo of this in Abraham, looking at both at the promise of Isaac's birth, but also being faced with the command to offer up his son, that the God who created everything out of nothing is able to be good on the promise of a resurrected life. So there's a sense in which these are human remains, but they're also not something that has to be held on to. The continuity between the earthly body and the resurrected body is like creation out of nothing. And so if there's a case to be made that these are human remains, I think there's also a sense in which the fact that they are human remains, the remains of a human being destined to share the resurrected life of Jesus, perhaps allows not a Platonic, this is just the husk and the real person is gone, but allows an approach to dissection that would say, in service of a greater good, this person who's given themselves, their remains for the sake of others, that I can treat these with respect, even as I reduce what was once a whole organism into its parts.
I'm certainly agreeing with all that Ross just said. I had a couple of quick thoughts. One is, I observe as people are dying, and I've heard this in my own family with family members who are dying. You hear people say they're not here anymore when they're still living, but terribly diminished, right? That's not her. I think that's the sort of thing we don't want to be too moralistic about it in those contexts, but that's a kind of thing that we generally should avoid saying, because it too easily reflects a lie. That's a very common cultural idea, which is this Platonic idea that almost the body at this point is a hindrance to the self, that the self is the thinker, the doer, the actor, the autonomous one, the one who has projects, the one who enacts their will on the world. And when that's not possible, the self is gone and the body is just a husk. And yet, as Ross said, they are remains, and the remains are remains. This is not the person. Once they've died, they are remains. And I think something to meditate on. I don't have any kind of way to draw this together, but to meditate on is potentially the way Christians have through the centuries, obviously not so much in Protestant communities, but have dealt with relics. And that the relics, often, which are like a fragment of the bone of some apostle or something, they've been treated really seriously. So just something to think about as we think about the proper kind of attention to the sacredness of these remains because of their relationship to the one who has died, but without treating the body as more than human remains.
Thank you.
Farr, I think it's in an article that you wrote. Maybe you can give the bibliography for it about these body exhibits. But you mentioned in passing that some anatomy labs close with a kind of service of remembrance and a respectful committal of the remains. And I think that's a way of honoring that, yes, what we've been doing all along here is handling a human form. And we can acknowledge here at the end, maybe for our own sake, as those who've been just an honoring of the person who gave themselves for this project. And there's a way of acknowledging at the end the holiness, the transcendence of what's been engaged in.
Thank you. Thank you, Ross and Farr, for the many that have asked questions. I've definitely learned a good bit and still have many more. So if you're in that boat, you're not alone. Actually, UNC has their anatomy memorial service November 30th at 5:30 p.m. To thank the families and the people who have donated their bodies. I believe Danielle will end this recording, but this recording will be posted on Duke Divinity's TMC website for later viewing. So if you know people that are interested in these conversations or these reflections, you are welcome to share that information with them at a later time. Thank you.